have on the line with me Dr. Bruce Young. All right. Dr. Young, number one, you are a physician, and you are also a missionary. Let's introduce you. Have you introduce yourself to our listening audience as the physician?
Sure. Thank you very much. I'm Dr. Bruce Young from Olathe, Kansas. I'm with the College Park Family Care Group, which is scattered throughout Johnson County, Kansas. And I'm one of several physicians in the group that does missions work on a fairly regular basis. I have focused mainly on Rwanda and typically take my family and go for a year to Kibogora Hospital, which is in the southwestern corner of Rwanda. It's something I felt God leading me into when I was in medical, and always kind of anticipating the opportunity. I was able to find a surgeon that would let me do a medical rotation with him when I was a medical student. And at that point, my wife and I both felt that we were being led by the Lord to make that a regular part of our lives. And so we basically try to come and help for a year, let the career missionaries take a year off to get themselves kind of refreshed and rejuvenated, and we fill in for them and give them a chance to do that. Being there for a year gives us a chance to really meet people, to be part of the culture, to have an impact. Last time we were there, we were able to work with several of the Rwandan physicians and help them to gain more growth in their walk with the Lord. We did a course called the Alpha Course, which teaches Christianity and some of the foundational things. So that's been part of my passion. So we go back about every 5 or 6 years or so and spend a year in Rwanda. We've also been to Kenya, Congo, Burundi, Tanzania, and feel like Africa's kind of a second home for us. We love the people there, and it's been really our joy to be able to have that experience. Absolutely.
Now, your specialty or your medical, shall we say, domain is what?
Family medicine. I'm a family doctor.
All right. You've explained just very clearly the tie as a missionary. And at what point did you realize that that was as equally important as your physical involvement? That's not a good word. Your caring for the medical needs as well as the emotional, spiritual needs of the patient and or a people.
Well, I've kind of felt that all along. My father is a Christian psychiatrist, so I come from a background where faith is integrated right in with clinical experience, and that's just been part of how I've approached my life, really. I mean, I feel like being a Christian is not just something that is encapsulated in one part of your life. It's part of everything you do. And I view myself as hopefully an extension of God's grace and mercy to other people. And so that comes fairly naturally when I'm able to speak with those who share their emotional pain or their spiritual challenges. And one of the things I like about the practice I'm in is it allows me to pray with people and to speak with them about where they're at in their walk with the Lord. I'm in a Christian practice, so we have Christian music. We have staff who are open to the things of God, and we have a Bible study once a month. So we have a culture that we've really tried to encourage, where the spiritual and frankly the Christian walk is encouraged. And so that's part of how we like to go through day-to-day practice here.
All right. Let's take a look at the perspective that you have as a physician doing missionary work in reference to Ebola. Shed your light on it as it relates to the first, well, I'm not going to use first, second, third, but the outbreak that was made known media-wise and made its way around the globe, coming to America, when the two individuals were immediately evacuated from Africa.
Well, let me give you a little more background. Having been in Central Africa I've seen several cases of hemorrhagic fever, and Ebola is a hemorrhagic virus. And so these are very scary illnesses. When they come into the hospital, we have an alert that is immediately started for the entire staff. In Rwanda, we've certainly seen these types of outbreaks, and so everyone realizes that it has to be strict hand washing, protective garments. And when I saw my first case of this as a physician, there really wasn't even any kind of way to test for this. We didn't have a sophisticated lab, but we knew of the hemorrhagic viruses that are available, or that not are available, but that are seen in that part of the world. Unfortunately, the patient died fairly quickly, so we had to go through the process of disposing of the body, trying to fit the cultural needs in with the fact we didn't want the disease to spread. That was a difficult balance. So having said that, Ebola has been around for quite a while. So is Marburg virus, so several other viruses that fit in this kind of category. The thing that's happening now is that it's gotten into a situation where it's spread faster than it ever has before. We don't know if that's because the virus has changed to a certain degree where it's more likely to spread more easily, or if there's just been a lack of good infrastructure to keep things contained. In fact, it's gone from 3 countries in Western Africa to now the United States.
What are those 3 in Africa?
Liberia, Guinea, and Sierra Leone.
All right.
So now that those 3 countries have had difficulty containing the virus, and the fact that it's now been seen in the United States makes us realize that we have to be ever vigilant about these kinds of infections. Unfortunately, the individual who came from Liberia did not tell the truth when screening questions were asked of him, and so the staff didn't have the right information to really deal with the questions that were asked.
What were those questions that should have been answered differently?
Well, I don't know the specific ones, but one of them was, have you been in contact with someone who has had the Ebola virus? Have you been around anybody who's displayed hemorrhagic fever? And evidently, the news reports that I've seen, and I don't have any other inside knowledge, just what I've seen, the individual did deny that that was the case. And then, in fact, later it was discovered that he did have direct contact with a pregnant woman who had Ebola, who later died. He actually helped get her to the hospital in Liberia. So unfortunately then, when he was exposed and then got on an airplane and came to Dallas, he was seen in the hospital. When asked about his risk, evidently did not give that information to staff, and came back in displaying the obvious signs of Ebola, which typically is a loss of ability to stop bleeding. So bleeding comes from different parts of the body. That's a very dramatic presentation. So, point is that when you have the possibility of the virus spreading like this, that kind of puts people on edge. And while we don't want to have a panic, we don't want to have people fearing that every cough and upper respiratory infection is the first sign of Ebola. We do want to recognize that people who are in a situation where they've come from that type of exposure need to be very vigilant and need to be honest about what their exposure has been.
Now let me ask this question to make sure I'm clear. The account that you are talking about is most recent, correct?
That's right.
All right, because I think I wasn't as clear as I thought I was. I was making reference initially to the first media exposure that was given to all of us was from the 2 individuals that were airlifted out of Africa. All right.
Oh, okay, yeah,
but
the 2 physicians.
Correct.
Yeah.
We'll work our way back. So, as far as the individual recently understanding what was most have heard and read and perceived and gathered from the media are that the individual went into the hospital, was experiencing some symptoms, and was dismissed by, or shall we say, sent home after the emergency room with whatever orders that were given, and then had to come back at that point. What was missed? Because, see, that piece right there, I think, is what is somewhat traumatizing in individual, causing them to be at a stalemate. Because if we say on the domestic end, United States has the ability to handle this, contain it, deal with it, etc., but yet one goes into the hospital and is sent home, and that person comes back, fortunately, then what's missing here?
Well, it's hard for me to say because I don't really know the specifics of how the interview process went through. I don't know what the physical exam signs were.
Correct.
Because Ebola it's a tricky virus. It can present looking just like a upper respiratory infection or a sinus infection, and without really having specific information about how the interview went, how a physical exam presented, it's hard to know, where the mistake happened. I would think, from my perspective, that someone who has come from one of these three countries really ought to have as aggressive testing as possible. So there may have been some tests they could do to check for possible viral infections. Unfortunately, to do the actual test for Ebola takes a little time. It's not something that's just going to be a 10-minute test. It's going to take a little while to get that back from the lab.
So the mere fact, what I'm hearing you say is that on the mere fact that that person had come from a foreign land and then coming into the hospital should have heightened suspicions to do some things out of the norm, period.
Yeah, that's my opinion.
All right. All right. And so then there is the premise and the questions from the community as a whole is, what potentially, knowing Ebola the way you do, and its, shall we say, its characteristics, knowing that that person had been on a plane and flying from Africa to Dallas, even though many are, shall we say, those in professional capacities are somewhat alluding to the fact that there's no way the individual could have been, what is the word I'm looking for, could have been contagious during that flight time.
Well, I don't know that. I mean, I wish I could say there was no way it could have been contagious, but I don't know how he was acting. I don't really have a good sense for the timeline.
Right. And then there is a name, the person's name is being withheld. There's unrest about that because many voices are saying, at least if we know who the individual is, we can be as proactive as we can be to get our families in to be checked, and or if we've had contact, whatever the case might be. What's your take on that?
Well, again, I think there's a balance between panic in terms of having concern about viral presentation, and then also recognizing people who've been in countries where they could have exposure, and then recognizing that people may or may not give all the information that needs to be given. So it's a very hard balance to strike.
I
now,
can
my
imagine.
understanding is that...
No, I can't imagine. Go ahead.
Yeah. Mm-hmm. Well, I believe the individual has been identified as a Mr. Thomas E. Duncan in the Dallas area. He is a native Liberian citizen. So at least that identification has been brought out. But now the question is, how does Dallas really deal with what happened there, and how do health officials work together with the community to keep this from spreading.
I would think that now that the name is out and those that were on that flight, as equally so, have their concerns, and as we know, a plane is for the purpose of transporting individuals from around the country. So that means that that passenger list, those individuals went on their way, and so they must too be at somewhat unrest. Would you address our audience, and as a physician and a God-led man, what do you say to us as individuals, as to men who are heads of families, to single mothers, and even to teenagers who are quite intelligent? Would you address them at this moment?
Well, I would say that let's not be afraid. We know that God is not the spirit, does not give us the spirit of fear, but the spirit of peace. Where the spirit of the Lord is, there is peace. So I would say that would be the number one backdrop that we need to have as we look at this situation. Secondly, I think we need to be open to hearing what God is saying to us in terms of just being good citizens and being fellow heirs of Christ. We need to recognize that God has given us healthy bodies, and we need to take care of them. And we need to keep ourselves from falling into a sense that, oh man, that Ebola is going to spread around our country and we're in bad shape and we're all going to get in trouble here. I don't think that's really the case. I think there have been several outbreaks of Ebola in the past, and this virus tends to flame out as people stay in infectious disease circles. Question is, how do we keep it from flaming out after it's already taken out, more people in our part of the world at this point? I think what we do is we continue to live our lives. We recognize that we've been exposed to people who've been in Western Africa. If that's the case, we talk to our physicians, talk to our family. We feel ill, we get looked at. We get the physician and make sure we get looked at. So I don't think we should panic. I think we need to recognize that we have a great health system available that we can take advantage of if we need to. I don't think we should expect that it's going to end up being a pandemic in our part of the world. I don't think that's going to happen.
And then for Americans who have family members, loved ones, acquaintances who have traveled to Africa during this time, and they will soon be returning home. What can you say there?
Well, those who haven't been in those three countries, Liberia, Sierra Leone, or Guinea, should not feel that they're secretly carrying a Ebola virus home with them. Africa is a huge continent. And, when you think about these places there, that's a very small percentage of the continent. So if you're coming from a country that's not one of those three, I would say carry on as normally. You would. If you come from that area, I would say there's a 21-day incubation period that observation ought to take place. People who have any potential signs or symptoms should seek help immediately. If you have a cough or congestion and you had fever, anytime you've been in a tropical environment, but especially in those three countries, then you definitely want to follow up with your physician to get checked.
As it relates to import-export commerce, what is your perspective?
Oh, I don't think those, at this point, I wouldn't say we have to change anything at this point. I think the countries have sealed their borders to a certain degree, and I would say that packaging materials should still be accepted. You're not going to carry live virus on a box. That's not how this works. It has to be person-to-person contact.
I do appreciate this time that you are given to the listeners of our community as a whole, United States of America. And because of how we are governed, is there any last thing that you would like to say or even release over the people's hearts and ears during this time?
I would just say pandemics have been a part of world history. Christians have had to deal with scary times, whether they be infectious disease or war or threats from every aspect of life. And so I would say, as we deal with any kind of concern or conflict or fear, let's press hard into the Lord, seek His face above all else, and I believe that He will give us the guidance that we need.
I'm going to say that I also believe that those who are clergy can benefit from this insight because of their relationship with parishioners, ministry gifts, relationships with discipleship and those followers, etc. I do believe that this will also enlighten them, strengthen them, and encourage their hearts as equally so. So if you, being also a missionary, would like to speak to clergy, speak to missionaries as a whole, I think this would be a good opportunity.
I would just say continue to press hard in the Lord, seek His face above all else, be good leaders, keep your head solidly in the Word, and don't allow media reports necessarily cause stress and anxiety that are unnecessary.
And on that note, Dr. Bruce Young, thank you again, and just know that you have a seat at the table of SB Barber Morning Show and GMNLive.com Internet Radio.